Hi, Dr. Garcia from Garcia Facial Plastic Surgery. Today I'm going to be covering your post-surgical instructions for rhinoplasty. Rhinoplasty is a commonly performed procedure, and there's a very specific set of instructions that we ask our patients to follow. On the day of the procedure, we're going to ask you to start using cold compresses. And these cold compresses are done in a very specific way. All I have here is a gauze that has been soaked in ice water. So what I have done here is taken this gauze, soaked it in the ice water, and I have wrung out the excess ice water. The gauze is still cold, so what we want to do is fluff the gauze up a little bit, and then we take this gauze and we put it right into the eye socket. Remember that for rhinoplasty, you're going to have tapes and splints all the way over the nose, but this gauze fits perfectly into the eye socket here, and it helps with the bruising and the swelling. We want you to start doing that as often as possible. That first day after the procedure, you do not have to wake up in the middle of the night to do this, but we're going to ask you to continue this the day after the procedure for at least 2 to 3 days after the procedure. So the cold compresses are very important. In addition to that, the day after the procedure, you're going to return to my office and I am going to clean out the inside of your nose. I do not pack the nose for rhinoplasty, but what I do use is some material that's absorbable right where the hairs are inside the nostril. And so we're going to remove that material. We're going to decongest the nose, and then we're going to clean your nose. But at home, we're going to ask you to do some additional care. The first thing is you're going to take a Q-tip with hydrogen peroxide, like so, dip the Q-tip into the hydrogen peroxide, and then you're going to clean the inside of the nose gently, just where the hair is. Only where the hair. You do not go in with the Q-tip. Just clean where the hairs of your nostril are in a circular fashion 6 times a day with the Q-tip with peroxide. After you have done the Q-tip with peroxide, you're going to use a little bit of Vaseline, again on a Q-tip. Put a little bit of Vaseline on the Q-tip, and then just apply that Vaseline where the hair is inside your nostrils. If you have an external incision along the bottom of your nose, we typically cover that incision with a piece of tape, and there's nothing for you to do along that incision. However, if that piece of tape falls off during the first 7 days, we're going to ask you to clean the incision here 6 times a day with a Q-tip with peroxide, and then put a little bit of Vaseline ointment on the incision as well. The final thing with rhinoplasty is your saline spray. This is the Arm & Hammer product, but there's many different kinds of saline spray. We do not want you to use a nanny pot. We don't want you to use anything except nasal saline spray. And we want you to use this the day after the procedure as often as you can. What I tell patients is purchase a few of these cans, put one in the car, put one on the nightstand, put one where you watch TV, and whenever you remember, spray the inside of your nose with the spray. We want this spray to coat the entire inside of the nose. So many times you're going to be congested on the inside of your nose. Sniff the product in so that it goes into your throat and you can taste the saline. That's how we know the product got all the way through your nose. This will help cut down on the crusting, it will help you heal faster, and it will also help with the nasal congestion. The tapes and the splints are going to stay on your nose for 7 days. Once we take those off, we will give you an additional set of instructions, but these are the instructions for the first 7 days after rhinoplasty. Thank you for watching.